Hi, my name is Mike Piazza. I'm Commissioner of the Department of Mental Health, Social Services, and the Youth Bureau. I want to talk to you today about taking care of yourself and your mental health in the face of the coronavirus epidemic. A lot of people have a lot of concerns. All of us, everybody has concerns, whether we're concerned about our health or the health of a loved one, especially an elderly family member, or we're worried about our economic situation. People have lost their jobs. A lot of people have lost their jobs. People have to pay their rent. People have to pay their mortgage, and they're really not sure how they're going to do that. So there's a tremendous amount of uncertainty that is happening in people right now in our community. And additionally, the lockdown, shall we say, or the social distancing rule, or the request to stay home um, and not to go out except in emergency situations really is something new for us, and it's something that we haven't experienced. So it's difficult to adjust to that. So I wanted to say a few things today about what you can do to help yourself and to take care of yourself in the face of these concerns. One is control what you can. If you have lost your job and you've been furloughed, you can apply for unemployment. You can take care of those financial things. That creates another problem because it's been so difficult to apply for unemployment because everyone's applying at the same time and the Department of Labor is overwhelmed. But it's what you can do to take care of yourself. And if you do go to the store, wear a mask and wear gloves. These are things you can do to take care of yourself. Most importantly, you take care of yourself and take control of the situation by not going outside. Do what helps you feel safe, whether it's going for a walk and maintaining a distance from everybody, whether it's reading a book, watching a movie, doing a hobby. One of our employees who is on rotating schedule, so we're trying to keep people here to a minimum, spent her day yesterday making face masks for the services staff that have to go out and make home visits. So I don't expect you guys, everybody, to go out and make face masks, but it was just a wonderful way for that employee to spend her day, take control of the situation, and feel better. Try to go outside when it's safe. Walking, getting your heart rate up will just make you feel better. It'll help stave off depression. People always feel better when they do a little bit of exercise. Try not to worry about the future. Right now, that you can't control, except if you control those things that we spoke about before, like making sure that you stay in. But this pandemic has a course, and it's going to run the course. You can do something to shorten it by staying inside. But in terms of how long it's going to take, there's an old phrase, don't push the river, it flows by itself. This pandemic had a beginning, we're in the middle, and it's going to have an end. All pandemics do. We have to keep our minds on the long term, that it is going to end. So try not to worry about the future. Stay connected and reach out. There are a number of ways to do that. There's an emotional support line run by the New York State Office of Mental Health. If you're in crisis or you feel like you need to talk to someone immediately, you can call the Putnam County Crisis Hotline at 225-1222. It's available 24 hours a day, 7 days a week. If you are in recovery from substance abuse or from a mental health condition, telephonic treatment is available. Our treatment agencies are speaking to people by phone. They're speaking to their clients. Some people are Skyping. Some people use FaceTime. Some people just the plain old telephone. And I'm happy to report that some of our agencies are treating just as many people now as they were before the epidemic started. That's a sign that people are using the phone and are feeling good about the treatment that they're getting. There are also virtual recovery groups. One link to the Prevention Council of Putnam County, which you will see, will bring you to a list of those recovery groups. Uh, and speaking to people, maintaining the social contacts that you had before this happened, even while maintaining social distance, is really going to be important to your long-term mental health. We are here for you. We want you to feel that even though you are alone in your homes, many of you, and you're separate and apart, you're not alone, that you can reach out, that there are people to talk to. Thank you very much.